Hi, my name is Kim Malloy, and I'm one of the general OBGYNs here at UNC. And I wanted to speak with you all a little bit about what PCOS or polycystic ovarian syndrome is. PCOS is a condition driven by an imbalance in hormones, and it can manifest in several ways. It can present with increased acne or increased hair growth on the face, the back, the arms, the lower abdomen. It can also present as irregular periods that can sometimes be spaced out by several months. It can also present as an issue with infertility and patients trying to conceive and who are not having success. Whenever we are evaluating a patient for polycystic ovarian syndrome, one of the common complaints that they come with is that their periods are not regular, often in the setting of trying to conceive. One of the ways that we evaluate patients is to get a thorough history, to perform a physical exam, and also to check blood work to look at some hormone levels, such as androgens like testosterone. Once we have obtained lab work, sometimes you will also obtain an ultrasound to evaluate the ovaries to see if there truly are polycystic ovaries present. We can diagnose PCOS without an ultrasound by just the fact of knowledge about periods being very irregular, occurring more than 35 days apart on a regular basis, as well as signs of androgen excess like increased acne and hair growth in areas that you do not anticipate. Once we have confirmed a diagnosis of PCOS, we will often evaluate additional labs to make sure that patients are healthy overall because PCOS is associated with insulin resistance. So we'll often check diabetes markers such as a hemoglobin A1C and also check a lipid panel to see if there's any issues with elevated lipids or cholesterol. Those are all areas that can be impacted with PCOS. We don't truly know the cause of PCOS, but we do know that when moms and sisters have the disorder, you're more likely to have it as well. Once we have established a diagnosis, it's important to discuss goals of care with the patient to determine how to best treat them and decrease their symptoms to the greatest degree possible. If someone is hoping to conceive, our primary goal is going to be to ensure that they're having regular periods so that we can help increase their chances of that happening. If someone does not have an interest in conceiving, it's about ensuring that they're having regular periods to make sure their uterine lining is protected from overgrowth and the presence of abnormal or potentially precancerous cells. Additionally, making sure that in patients who have elevated blood glucoses or signs of prediabetes, that we also treat them appropriately to decrease the risks of them transitioning into diabetes.